So this is Willa, and Willa's having some pain in her hip and her knee when she's squatting. To accentuate that, we're going to have her do a one-legged squat, so go ahead. And you can see when she does that, kind of her butt goes a little back, her knee comes in, and it's a bit shaky for her. Is that uncomfortable for you?
It's a little uncomfortable in my knee and the side of my head.
Okay, great. So to help Willa with her squat, what I want to do is I want to try to distract it because I think the ball's not quite centered, it's kind of compressed in the socket, so I'm going to distract it, and then after that I'm going to try to put the hip back into place, kind of nudge it into the socket. So to distract it, what I do is I come, I grab her leg, and I'm just kind of trying to find a spot where when I give a little pull, it feels like it just doesn't want to come out of the socket, right about there. And so you feel that feels okay there? And then once I get there, I just give a quick little tug, and that's how we distract it. So now that we've got the hip distracted, we want to kind of get it centered in the socket. And in order to do that, what I'm going to do is I'm going to lift her leg to the side, and I'm going to feel her hip. And at a point where it feels like it wants to kind of push out to the side, I'm going to just kind of try to nudge it back in. And from here, I'm going to say, don't let me move you. As I try to lift her leg further, that kind of adds some tension to my hand and helps the ball just kind of nudge down into the socket. Let it go. I repeat it one more time. Don't let me move you here. And now I feel that kind of sinking in, so it feels like the ball's going to fit better in the socket, so she'll be stronger and have better balance. Let it go. Now when she's done, I want to make sure that her brain remembers how to use this motion because it's kind of hasn't been there for a while. So now I'm going to say, okay, just hold yourself here. Don't let me push your leg down and forward, and just keep it there. Good. Match me there. Good. And this is just reminding her body of how to use that. Now that the ball's centered in the socket, how do I use those muscles again? So when she goes up to squat, that kind of keeps it centered in the socket, keeps her feeling strong and balanced. Okay, so we've done our treatment, so let's see if it's affected her strength and balance. So you can go ahead and do the one-legged squat again. And again, it just looks a little bit straighter. How does it feel to you, Willa?
Less painful and much smoother.
Much smoother. Okay. And that's kind of how we approach things with the functional manual therapy approach.